Good evening and welcome to our COVID-19 update. I am Ladi Akeredoluale. Here are the highlights at this hour. Abia State Governor Okezie Ikpeazu resumes work after treatment for COVID-19, just as Ekiti State Governor Kayode Fayemi tests positive and goes into isolation. Non-compliance is part of the creation of hotspots for COVID-19 in Nigeria's commercial capital and epicenter of COVID-19, Lagos. And World Health Organization says no first use of vaccines for COVID-19 should be expected before the year 2021, just as global cases surpass 15 million. We'll get to the story about Dr. Okezie Ikpeazu and Dr. Kayode Fayemi in just a moment. But let's start off from Enugu State, where private medical practitioners have called for the need for more collaborative efforts between the private and public sector in the management of COVID-19 in the state. According to them, incentives like those of grants, soft loans, and others will encourage local diagnostic testing and isolation of patients for de-escalation of COVID and community spreading. They also believe that sincerity of purpose, openness, and willingness to try out new ideas, amongst other things, are what is needed at this time in the fight against COVID-19.
According to the recent data from the Nigeria Center for Disease Control, Enugu State has 705 confirmed cases with 371 discharged cases and 17 deaths. The state government has in the last 4 months set up different isolation centers in the state for the management of COVID and a new committee for de-escalation of COVID-19. Although the government seemed to be on top of the situation, private medical practitioners are asking it to bring in the private sector with incentives for the management of COVID-19 in the state.
I believe that government needs to give incentives to private sectors. People who want to go down to the rural areas, they give them incentives. People who want to establish isolation centers, people who want to go into private testings, they give them proper incentives to do so. They can give them soft loans, they can give them reduced cost loans, they can give them loans even in terms of machines they use in doing this testing. And with that, you see, the private sector will embrace the process.
Others believe a sincerity of purpose on the side of government is what is needed at this time to drive the public-private partnership in the health sector.
The first thing should be a willingness and openness. The government should be willing and open to get this thing running, because where they are, that's the incentive that anybody needs, the private sector needs, and that willingness will mean, coming to, a discussion to form some kind of collaboration, because the private sector, they have certain challenges that will make it not possible for them to go on their own to take care of the pandemic.
However, there is a call for the government at all levels to provide diagnostic centers across the 109 senatorial zones in the country to facilitate rural diagnosis.
The rural belt of our senatorial zones needs to be empowered to diagnose not just COVID-19, but other related diseases. It is in the rural corridors that we can be able to capture information that we can even use as statistics to evaluate whether we are going forward or going backwards. Okay? I am of the suggestion that if we have one good diagnostic center in one senatorial zone, in the rural corridor of that senatorial zone, and we have about 109 spread across the country, then we'll be getting our people will be getting diagnosed, getting laboratory results, getting radiography results at the rural belts.
Even though government says it has done a lot in general COVID management and still open for more conversation with the private sector, there is need for all hands to be on deck if COVID-19 must be fought to a standstill.
From Enugu to Abia, where the state governor, Dr. Okezie Ikpeazu, says his administration will continue to provide the needed support in the fight against the COVID-19 pandemic, appealing to residents to take advantage of the molecular lab, which is now fully in place, to get tested. Dr. Ikpeazu made the appeal after returning to work and recovering from COVID-19. He says he remains grateful to his people for their prayers, the deputy governor as well as members of the State House of Assembly for their support during his absence. Meanwhile, his Ekiti State counterpart, Dr. Kayode Fayemi, becomes the latest high-profile individual to test positive for COVID-19. The governor, who confirmed his status on his Twitter handle, says this was his third time of taking the test. Babajide Agbeo has more.
Consequent upon his testing positive for COVID-19, the governor of Ekiti State, Dr. Kayode Fayemi, has gone on self-isolation as he will be running routine duties from home while ceding critical responsibilities to his deputy. The governor is said to be in a stable condition as his wife and close aides have gone for testing as expected in the present circumstance.
Every member of the cabinet has been directed to go for a COVID-19 test by the governor, even prior to the result of his own tests. Now, His Excellency, in his own case, makes sure that he tests himself periodically. Like he tweeted, this test is his third test. The first two tests came out negative, but unfortunately, this came out positive, and he has done the right thing by isolating himself and getting treated. Now, with regards to the number of cabinet members who have tested positive or negative, well, I believe that is a personal thing. It's left to them to either say, okay, yes, I've been diagnosed or tested as positive or not. It's not the duty of the Ministry of Health or the Ministry of Information to give out such information.
Meanwhile, the COVID-19 task force in the state is advancing with community testing, coupled with aggressive enforcement of the use of face masks and other rules. 1,000 samples have been tested across 5 local government areas in the state, and the testing will be going around all the 16 local government areas. The task force has advised citizens and residents to again at this time take responsibility, keep safe, and avoid all forms of risk. Babajide Agbeyo for COVID-19 update.
Thank you, Babajide. Obviously, the fight against COVID-19 is not over, as shown by the number of confirmed cases indicating that the spread is heavier in some locations. Data earlier released by the Nigeria Center for Disease Control, the NCDC, show that 11 of the 20 local government areas that account for 60% of the national caseload are in Lagos State. Our correspondent, Dare Dowu, visited some of these areas to seek answers on what could be the root cause of the spike at the community level and efforts at reducing the spread.
Alimosho, Koshofe, Mushi are among the most populated local governments in Lagos State. But Etiosa, one of the least populated, leads the pack with the highest number of COVID-19 cases in the state. Obviously concerned, the Lagos State government, through its agencies, have been enforcing regulations to minimize breach of protocols across the state.
There's a lot of emphasis on us, particularly with regard to Etiosa. We enforce daily. We carry out our regular enforcements also over the weekends.
Enforcement or not, the state appears to be back to its pre-COVID-19 days and also in full swing. There are other interventions to back the non-pharmaceutical approach, and Professor Babatunde Salako leads the team here at the Nigerian Institute of Medical Research. He explains the different possibilities around the trend of heavy community spread in some locations.
Some people, mistakenly thought that COVID-19 is a disease of the rich, because the people who brought it are people who have money to travel abroad and come back home. And if you look at this local government that you are talking about, you will see that a lot of the elites in Lagos who are well-to-do, or who could be described as well-to-do, live in those areas. When it became clear that people can go to isolation center and come back and get well, then the fear was beginning to go down, and people came out for testing.
There are different explanations as to why there could be a concentration of the spread of COVID-19 in some areas, especially in the Lagos State. But there's only one way to find out, through testing. Nigeria may not be testing enough, but this drive-through center is an effort in that direction to ensure that more people get tested. So people drive in, and the samples and the information collected, they wait 24 hours or 48 hours to get their results.
few kilometers away from the testing center in Lagos mainland, at this densely populated market in Mushin, one of the local government listed as a red zone, most people here can't be bothered. Those with face masks properly worn appear to be the odd ones. Majority have their mask permanently lowered to the jaw level.
Let me also...
The federal and state governments have imposed different restrictions and protocols, aiming to reduce transmission of COVID-19, but activities across the state suggest there might be some slacks, making it more pressing for authorities to recalibrate its efforts to finally fight the virus to its knees. Dari Ito, Channels Television News.
From Lagos to the northern parts of the country, the Taraba State Technical Committee on COVID-19 says it has intensified community contact tracing of persons who have come in contact with patients they have at isolation centers. The chairman of the committee, Dr. Innocent Vakai, while briefing journalists on the update of 24 new cases recorded, disclosed that there are cumulative cases of samples sent 2 weeks ago. He adds that over 500 samples have been sent to the NCDC, of which 54 have been confirmed positive. Dr. Vakai notes that all hands are on deck to have a testing center in the state, with which there is a likelihood of having more cases if testing starts in Taraba.
We have commenced active case search in the community because currently we have tested over 500 samples. And if you look at it statistically, we are having barely 50-something confirmed cases in Taraba State as against the 500 plus samples that we have tested. And if you look at the statistics nationally, Taraba State and few other states are the few states that have less than 100 number of confirmed cases in the country. We are working hard to have a testing center in Taraba State. When we have a testing center, we are likely even to see more cases because the pandemic is still ongoing, and this is just the first wave of the pandemic. It has not reached its peak because there's a lot of community transmission. And out of the 24 positive samples that we saw, most of them were contacts of initial people that were tested positive. So when they follow up their contacts, they also were positive.
In Jigawa State, the Medical Association there laments the shortage of manpower in the state's health sector. The Secretary General of the association, Dr. Jibril Yusuf, who spoke to Channels Television, says more and more doctors are leaving the state. However, the state government says it is sponsoring students to study abroad in order to bridge the gap.
Oh, it is interesting to know that as a medical student that belongs to the Jigawa state government, receive a salary that is worth like that of a deputy director in the state. But then, so things are actually very okay as a student, but when you graduate, things started to change when you come back as a medical doctor with the state. Number one, you have to start battling with the issues of your own upgrade to a particular level at which you are supposed to, and formalization. Quite a number of doctors are annoyed with that, and it has been there for quite a long time, including myself. I've suffered such issues. But then in the general hospitals and cottages, manpower is actually very low. It's not, if not at an alarming situation, because you'll see the whole of the general hospital, the number of doctors are not more than 5 or so.
From the Nigeria Center for Disease Control, NCDC, 344 persons have recovered in the last 24 hours in 13 states plus the FCT from COVID-19. Kaduna recorded the highest number of recoveries, that is, discharging 59 in total. However, according to the government, 20 samples returned positive out of 108 tested. The new cases are from Chukum, Jema, and 1 each from Kaduna South and Kaduna North. There were more recoveries in states like Osun, where there were 56, the FCT 41, Plateau 37, Rivers 36, Lagos 29, Bayelsa 21, Edo 20, Ogun 14, Enugu 11, Borno 8, Delta 4, Imo 4, and Oyo 4. States in the top 5 of highest recoveries are Lagos, which has discharged 1,993 patients, followed by Edo State with 1,300. Kano is at number 3, discharging 1,125. 1,120 persons have recovered in Oyo State. Rivers is number 5, having discharged 1,039 cases of COVID-19. Total recoveries in Nigeria stand at 15,677, with confirmed cases at 37,801. 805 deaths have been recorded in 36 states and the Federal Capital Territory. In the meantime, over 748,000 confirmed COVID-19 cases have been recorded on the African continent, with more than 409,000 recoveries and 15,000 deaths. Let's discuss the issue of manpower, which we started yesterday and today, focus on involving the private sector, which some of those who have spoken in our area reports have mentioned. We're being joined via Skype from the Agbara area of Ogun State by Dr. Adeyeye Arigbabuwo, President of the Healthcare Providers Association of Nigeria. He joins us from there. Dr. Arigbabuwo, thank you for your time. Good evening and welcome to the program.
Thank you. Good evening.
What do you make of the general idea of people asking that the private sector, both in terms of medical personnel and institutions, should be brought into the overall strategy to contain the spread of COVID-19?
Thank you. The strategy is actually, we will say, is overdue. At the beginning of the COVID saga, some of us suggested that we should start it on immediately because the health sector in Nigeria is mainly private driven, having about 65 to 70% of the private sector providing the needs of healthcare of the populace, and the government is left with about 30 to 35%. So in a pandemic of this nature, there shouldn't have been anything like differentiating between the public or private. It is a matter of going into a kind of conjugal understanding where the two parties will just work hand in hand, especially before the community infection started. However, looking at the strategy for now, it's high time we noted that doing even the spot testing, the way we did for HIV those days, where we used to do spot testing, and then people could now go later for confirmation. By spot testing, we can easily sieve the sufferers or the suspects, against those who are probably looking good or testing good. And as at that level, that would be initial way of separating the wheat from the chaff. And that should have been a way to reduce community infection as we are experiencing today. However, the government's capacity is already overstretched. And you look at it, even today, the number of testing we are doing per day is far much lower compared with our population. Our population figure. We are talking of a country with about 200 million people, as we have estimated, and we are probably doing. We have done in 6 months what America probably have done in just 2 days. I mean, doing about 200,000 people so far, while America was doing about 100,000 per day. I mean, that is just something. America is a population of 350 million people. Nigeria with 200 million people.
Sorry, so Dr. Arigbabuwo, let me just interrupt you. Please hold that thought. We've got to take a break at this point. When we come back, we'll continue with this discussion. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 update. Well, the bulk of the management of COVID-19 patients in Nigeria have been by the various state governments at isolation centers and health facilities run by the states. These facilities have been identified as inadequate owing to the increasing number of active cases in the country, which currently stands at 37,000 plus. The bed spaces for COVID-19 patients are estimated to be below 6,000. In Lagos, very few private hospitals have been given the go-ahead to manage COVID-19 patients based on accreditation by the government. As the federal and Lagos state governments look into the modalities for COVID-19 home care for patients, what role can the private sector play in COVID-19 prevention and management? The president of the Healthcare Providers Association of Nigeria, Dr. Adeyeye Arigbabuwo, has been with us via Skype from the Agbara area of Ogun State. Dr. Arigbabuwo, thank you for your time and thank you for staying with us. Before we took the break in the discussion, we were talking about the private sector and how they could be brought in. There is something, though, that a lot of people say is responsible for the reluctance to bring in the private sector. Actually, there are two things. The first is the possibility of very high costs involved in bringing in the private sector. And the second is the proliferation of quacks in the medical profession.
Thank you very much. In terms of cost, in a pandemic period like this, we've had donations from big brothers all over the world. We've had the NGOs playing their role. We've had what we call corporate social responsibility. People have been coming, pushing in materials left and right. The private sector is at the grassroots. Like I mentioned much earlier, government has 35%, private sector 65%. We need accreditation of more healthcare facilities. We don't need to begin to concentrate on costing or no costing. As we are looking at it today, it is possible to acquire the test kits for cheaper amount of money than what we thought before. Even government on its own part quoted a lot of money initially that they were using to test per person or per head. Now things are much cheaper. Are we going to wait until we record so many fatalities the more before we begin to think of bringing in the private sector? As we are talking now, it has remained the first place of call. In fact, a lot of people shy away. They have their family physician. They have their personal doctors. They feel freer with their primary and private health facilities to consult with than the bottleneck they experience when they go public. A lot of the people who do the test 2, 3, 4, 5 days, the result will not come out. Some will run after the results, they will never get it, so to say. And when by the time they got it, probably somebody was nearing his grave. And these are the concerns we have. We don't need to begin to segregate to say this is private, this is public. We need to accredit more healthcare facilities. We need to put in the guidelines and the standards that they need to meet. We don't have to politicize. Gathering statistics and just using them to work on is not what we need now. We want to reduce morbidity, we want to reduce mortality. That is our concern that we have now. And we should not politicize the health of the people. It's not a matter of somebody doing it.
Dr. Arigbabuwo, yesterday, one of the subjects that came up is the issue of availability of medical personnel themselves. And I know that the private sector also suffers from this shortfall, the shortage of doctors, the shortage of nurses, and other medical personnel, radiologists, lab technicians, and so on. How do you think that this gap can be bridged even as the private sector is brought into the management of COVID-19 cases?
Thank you. Even before the COVID-19, we had this exodus of doctors and other health workers moving out of the country. We've turned to be the kitchen where we bake and manufacture. Others out there help us to utilize the human resources. What is it about? The people we have on ground right now, they are not even being adequately motivated. And so even the risk we went through during the Ebola period is almost the same risk we are going through now as it is. And people, or let me say healthcare workers, are worried. You sign contract with them, you sign agreement with them. How many of such benefits or motivation that we say, or incentives we are supposed to give them, have we fulfilled? Even the volunteers who have been working, have we been fulfilling our own part as a government? So we're worried, but in the pandemic, like I said, what we need is the survival of the people, not to take the credit, not to take the pass mark. Now, as we're looking at it, people are migrating. If you don't value the people you have, if you don't know what they are doing and the risk they are taking, other countries are ready to welcome them to go and work, and then they get the multiple of the money when it is turned over in terms of the value of the naira, or the capacity of the naira, or the strength of the naira against the dollar, if we have to put it that way. The way we are going it now, if they are attracted, even if volunteers are attracted or they are motivated better out there, you rather prefer to go. Only those who are around there are the ones that are actually going to say, okay, we have nowhere else to go, let us stay. It's not because they are happy, not because they're satisfied. But you can't be away where you're having the story or issue of your cousin, your mother, your father dying of this COVID-19. So the passion in us and the kind of patriotism in us is what is still making some of us to stay around. Patients don't even have the money to pay now. So it's a matter of us even coming out to take all of the risk on our shoulders. In fact, we are in an emergency of what we call medical warfare. So nobody should begin to talk of costing or anything. Is it that we are working now to begin to work from answer to question or question to answer? We give figures, for example. I don't want to go into what the general public is looking at. COVID-19 is real. There's no scam about it. What we need to do is to have a conjugal relationship, to marry the public and the private on time. We are late already, but we need to do it as fast as possible now to safeguard.
Thank you very much, Dr. Adeyeye Arigbabo. Thank you so much for your perspective on this topic this evening. Dr. Arigbabo joined us via Skype from the Agbara area of Ogun State. The Benue State government has directed the 23 local government areas and appeals to the organized private sector to patronize the State Ministry of Science and Technology, which is now producing automated hand washing machines, alcohol-based sanitizers, as well as ventilators to curb capital flight for all COVID-19 related procurement. Governor Samuel Otom made the appeal on Monday during the formal presentation of about 1,300 bottles of alcohol sanitizers produced by the State Ministry of Science and Technology, noting that Nigeria must leverage on all available opportunities during the pandemic to broaden manufacturing activities. Pius Ambo has more.
Like in popular parlance, necessity is a mother of invention. In Benue State, the Ministry of Science and Technology is taking advantage of the COVID-19 pandemic to delve into manufacturing. First, they began with the manufacturing of local ventilators, which was presented to the governor some time ago. They also processed with digital hand washing machine. Now, they have come up with alcohol-based hand sanitizer that was purely manufactured by the ministry in Benue State. The Commissioner for Science and Technology has just confirmed that they will go commercial, as they have directed that all local government chairmen should liaise with the ministry to ensure massive production of the alcohol-based hand sanitizer and distribute to residents to curb the spread of COVID-19.
It is not just a sanitizer that people just go and produce anyhow. It's a standard World Health Organization approved sanitizer in line with the COVID-19 policies and principles. So we actually did this to make sure that we, the youth of this country, the youth of Benue State, will think out of the box to do something for their life and for the citizens and for entire Nigerians at large.
In relation to the confirmed cases in Benue State, the Commissioner for Health, Dr. Sunday Ongbabo, has said nearly 300 cases have been confirmed, with over 90 of them discharged, while 6 deaths were recorded. He also said that this is directly in relation to contact tracing, that the rising number of confirmed cases, it is because contact tracing is seriously being paid attention to in the state. For every confirmed person, all the circles of contact are traced and they are tested. And he has asked residents not to worry about this, rather they should watch their circle of meetings where they go to, use of face masks and regular hand washing. He has advised that Nigerians and indeed Benue people must take seriously their personal hygiene and health concerns. From Makurdi, the Benue State capital, Pius Angbo for COVID-19 update.
Now joining us to discuss or expand this discussion on the role of the private medical sector in COVID-19 management is the chairman of the Guild of Medical Laboratory Directors in the Federal Capital Territory chapter, Mr. Ikechukwu Ononoju. Mr. Ononoju, thank you for your time. Welcome to the program this evening.
Good evening, Ladi. Thank you very much.
The private sector has been brought in somewhat into this process. But as the previous speaker in the interview before yours mentioned, the private sector had been calling all along for them to be brought in more fully into the process. But as I asked him, and I'll ask you too, don't you think the issue of profit, the question of cost, will prevent most Nigerians from being able to access the facilities?
Actually, that is a factor. There should be the issue of the cost is actually an issue, but you see, the more important thing here is that if we take it as a very serious issue, then the whole NGOs, the whole global donors in the world, can also invest the same way they are supporting the government. They should also support the private sector as well. And once the funds are available, and these private sector are also sponsored the way the government's public sector is being sponsored, I agree totally that the issue of course will be out of place. The same way that they've been sponsoring some other health issues. We've seen some programs like that they have also sponsored. And because they have sponsored and paid for it, then there was no issue of asking the patients or the clients to actually pay. But in a situation whereby everything is left for the private sector to actually foot the bill, then it should, that's when you talk about cost. And now I'm also aware that there is a guideline already laid down by the NCDC in collaboration with MLSCN in the case of laboratory setting up of laboratories for testing. And I think that should also be so in the counterpart of the doctors for treatment. Now, in that guideline, it was stated that government is going to make provision for everything that is needed. So if they actually make the provision as stipulated in the guideline, then the issue of costs will actually be reduced to minimum, and people can easily actually assess that.
The other part of the argument has to do with the quality of what is being offered and how it is being offered. We have been inundated with reports of people showing up at private health facilities under situations of emergency and getting turned back. Instead of being directed as to where to go, they're being turned back. And then there's the quality of the medical personnel themselves in the private health care sector. Do you think this should be addressed before they are brought in fully, or should be addressed just as they are being brought in?
Actually, the issue of quackery is a challenge in Nigeria. And but I want to say that it is not only restricted to the private sector, so to say. But what is important here is that there is already a guideline set down. If that guideline is actually followed strictly, so what that means is that the authorities are supposed to come to those facilities and inspect the structures they have on ground. They also, not only the structure, not only the facility, but even the professionals, those people who are the health caregivers, they will also assess what they actually have. So why we are saying that we need private sector incorporation, we are not saying that we want the standard to be compromised. No, in fact, in private, except for people who really don't understand business, we understand that quality is actually the highest marketer that goes out to preach for you. But when you use a substandard person or substandard personnel to actually work, what you are trying to do is that you are demarketing yourself at the long run. So what I am thinking is that the issue of quackery may not necessarily be there if actually the laid down guidelines are strictly followed, and those people, facilities that are selected based on merit. And when they actually do this, it will not be the issue. There will not be any issue of whether they are quacks or not, because already they have already passed the evaluation stage.
Thank you very much, Mr. Ikechukwu Ononoju, the chairman of the Guild of Medical Lab Directors in the Federal Capital Territory chapter. Thank you for your time this evening and for your perspective.
Thank you very much for having me.
Restaurant owners and workers in South Africa's tourist areas, including Cape Town, today began peaceful protests against the government's reimposed curfew, as well as a ban on the sale of alcoholic drinks. Many are protesting the loss of jobs and businesses and call on the government to reverse the restrictions. Our South Africa Bureau Chief, Betty Dibia, brings us the update.
As they had threatened a few days ago, on the menu today were empty dining seats on the streets and placard-carrying workers in the restaurants and associated businesses.
I think as an industry, we employ a lot of people, and we obviously are on our knees right now. So we're asking our amazing government to please stand up to the plate, step up to the plate. Our staff haven't received UIF. We've had very little help, and we're just hoping that we'll be taken seriously this time and we get back to business.
It's been very bad. I mean, the constituency that I represent, which is taverns, is made up of 34,500 taverns across the country. And this ban on liquor is actually affecting their livelihoods. And we're worried that more than 50% of our taverns will not be able to operate once the ban has been uplifted.
Apart from the owners, for the workers too, it's been rough these past weeks, especially with the renewed ban in the sale of alcohol and curfew.
Well, we've had no income since March. We've had no help from the government. There's been no UIF payments. So yeah, we've just been battling.
We need extended working hours. We need the unbanning of alcohol, the reduction of this curfew at night.
Most of the people, they're scared to come in and sit. So we're now having like a few tables.
I mean, it have been so hard, especially in the, us as waiters.
The National Liquor Traders Council, the Liquor Traders Association of South Africa, Business Leadership South Africa, and the Restaurant Association of South Africa are leading this protest. And they got the ear of government as the Minister for Tourism, Mameloko Kubayi Ngubane, came by to receive their memorandum of demands.
Would be most appreciated. I will definitely take both of this back to my colleague, Minister Dlamini Zuma, but also to the President. We did arrange earlier on in July, June. We did arrange earlier on that the President did meet with the sector. We did present together with the sector the issues. We continue as the department to raise the issues that affect the sector.
Whilst we appreciate and afford the opportunity for her to talk to us today, we certainly need to talk to President Ramaphosa, and we need to talk to Minister Patel and Minister of Kokta to enable us to be able to present the favourable solutions that we've got in lifting the liquor ban, 1, lifting the curfew, 2, talking about the interventions with the financial institutions by making it affordable for us to lend and find cash flow. At this stage, the banks have red flagged us as being high risk, so we cannot continue to trade without income. We also need the UIF to dedicate people to our industry to be able to pay out our UIF payments within 48 hours. We've asked for TERS to be extended, which has been done yesterday, so we certainly are appreciative of that.
And so engagements continue, hopefully with all sides at the table, with the expectation that the sector will sheath their swords and cease for now. The prayer for all is that COVID-19 will be a thing of the past soon enough, and life will get back to normal again. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
Outside Africa, the United Arab Emirates government has given a 3-week ultimatum to Nigerians living in that country with expired visas to leave. But according to the Nigerian embassy in Abu Dhabi, those whose visas expired on March the 1st have been granted waivers on fines and penalties on the visas. It called on citizens who are affected by the order to submit their papers for emigration processing and advised them to join the evacuation flight scheduled for August the 1st and or subsequent Emirates evacuation flights before the deadline of August the 17th. Those willing to pursue the avenue suggested are also advised to submit their names and passport numbers to the embassy and or the consulate for forward transmission to the UAE authorities in order to obtain the necessary clearances. In Europe, the British government has said care home residents in England can begin to reunite with some of their loved ones. Visits will resume in care homes once local authorities and local public health directors say it is safe. This comes a day after the UK government announced that it aims to secure stocks of not one or even two, but up to 12 vaccines that are being developed around the world, hedging its bets to ensure it has something that works as early as possible in order to help end the health, social and economic havoc being wreaked by COVID-19. Juliana Olainka has more.
Britain's COVID-19 death toll is nothing to be proud about. Currently standing at over 45,000, the country has one of the worst fatality rates in the world. The same cannot be said about the race to find the world's first vaccine. This week, British scientists have reached another breakthrough in research. A vaccine being developed by pharmaceutical company AstraZeneca and Oxford University has produced an immune response in early-stage clinical trials.
We know there's an immune response to the vaccine, and it's the kind of immune response we're looking for. We don't know how big that immune response needs to be. And it may be that quite a low-level immune response could completely protect against coronavirus vaccine, and that's going to mean that it's very easy to develop a vaccine against it.
There are currently more than 100 vaccines being developed and tested around the world to stop the COVID-19 pandemic, which has killed hundreds of thousands and ravaged the global economy. There are no approved vaccines for COVID-19, but the World Health Organization has said that the recent AstraZeneca's ambitions is one of the world's leading candidates.
Nice to see you.
British Prime Minister Boris Johnson is remaining cautiously optimistic, investing in millions of doses of vaccines in case of a final breakthrough.
The UK has got some world-leading scientists engaged in this, as the Oxford programme, where we've secured 100 million doses already. What we're saying today is we're investing also in a couple of potential vaccines, one French, one German, 90 million doses that we're going to be investing in there. But I'm hopeful. I got my fingers crossed. But to say that I'm 100% confident that we'll get a vaccine this year or indeed next year is, alas, just an exaggeration. We're not there yet.
Not there yet is a crucial statement. As the world begins to slowly emerge from lockdown, a return to normality cannot be guaranteed until a vaccine is found. Juliana Olainka, reporting for Channels TV News in London.
Let's join Juliana in London now via Skype, shall we? Juliana, nice to see you. Trust you're keeping safe.
I'm keeping safe, thank you, laddie. Nice to see you too.
Not one, not two, but 12 vaccines?
12 vaccines, and of course hundreds of vaccines more across the world. I think Prime Minister Boris Johnson there was being pretty honest in saying that, the scramble to find a vaccine is on. We know it's the best and safest, possibly the only way to get rid of this COVID-19 pandemic that has completely ravaged the entirety of Britain. 45,000 people have lost their lives. The numbers, even though they're declining, are not declining fast enough because, of course, Britain needs to get itself out of lockdown. We already have been slowly coming out of lockdown. I heard you mention there the government's announcement today that finally relatives can go and see their loved ones in care homes. But I've got to say, as much as the Prime Minister and the British government have faced, I think, pretty obvious criticisms in terms of them leading in the world in trying to find a vaccine, is pretty good. And, the World Health Organization have responded positively to the study reports, which was announced by Oxford Scientific University as well as AstraZeneca on Monday. So this is good news. But like the Prime Minister said, cautious optimism is needed.
The other part of this, of course, is that the continuing drive for a balance between public safety and public health continues to be the situation at this point. The relaxation of things, allowing people to return to some sort of normalcy. The last time we spoke, the target was somewhere around Christmas. How is that going?
Well, it's going slowly. Christmas is a long way away. At the end of this month, I believe indoor swimming pools will be open. Spas will now be given the green light, which is important. Last week, Friday, we did hear from the Prime Minister, and he said to employers that you can change the tone that you're giving to your employees, that from August the 1st, he would like employers to encourage people to go back to the office. And that's a really important step, because we know that when people are in the office in Britain, you're more likely, of course, to buy a coffee, go to dinner after work, and buy clothes on your way home. And that's exactly the kick that the economy needs. But Brits are pretty comfortable at home. They're safe at home. They don't enjoy the commute. We know that London can be a rat race, millions of people on the tube every morning. And some big companies, including the Royal Bank of Scotland, now the NatWest Group, have announced that they are allowing their staff to work from home until late next year. And that's exactly what the Prime Minister doesn't want. But from Friday the 24th, people have to wear face masks in public places. And I believe the government have done that just to see if they see a surge of people going back to work and getting on the tubes.
Of course, the economy is the other big argument here, and the issue of employment or lack thereof. Rishi Sunak, that's the Chancellor of the Exchequer, did produce some very well-praised initiatives. What else has happened along those lines?
Well, as you said, Rishi Sunak has been hailed. Those initiatives have really been keeping Britain afloat. The government are paying the wages for 9 million people, but that can't continue forever. That's going to be coming to an end in October. From the end of this month, that will taper down from 80% to 60% of wages. And there are some people that fear as soon as that furlough scheme is withdrawn, then there will be mass redundancies. Unemployment in Britain currently stands at 3.9%. Some conservative estimates predict that by the end of the year it will be 12%. We lost 70,000 jobs last month. Marks and Spencer, the latest big British name, to cut 950 jobs. So it's a pretty difficult road for the government. Today was the last Prime Minister's questions time. Parliament is on recess now, and I think Boris Johnson will welcome that break. You know, he's had a pretty tough time. Not only did he fight COVID-19 himself, Britain is one of the worst affected countries, and I think this is, the most difficult period any British Prime Minister has faced during peacetime.
Thank you so very much, Juliana, for that update. And please, please continue to be safe out there.
Thank you.
The World Health Organization has been supportive of recent progress made on developing a vaccine for COVID-19, but says first use cannot be expected until early next year. The executive director of the agency's emergency program, Mike Ryan, says it is vital not to cut corners on safety, even if this means slowing the vaccine's development. Meanwhile, the number of COVID-19 cases globally has exceeded 15 million, with more than 618,000 deaths. The United States remains the country with the highest number of cases at more than 3.9 million. On the side, in spite of its miracle herbal care for COVID-19, Madagascar today reported another record day with 614 infections. The country now has more than 7,500 COVID-19 cases, as some hospitals say they're saturated even when the peak of the pandemic in the country is reached. That's the program tonight. Remember, you can get more updates on the COVID-19 pandemic and other top stories on our website, channelstv.com. I'm Ladi Akiridoluale. Thanks for watching. Good night.